So I'll go ahead and call this meeting to order. It is Friday, January 8th. So thank you for joining us. I'm going to read our board norms and protocols as we do at every board meeting. So as a board, we agree to respect the differences of opinions in making decisions for the district, to follow best practices in managing the superintendent and the management of the board itself, to stay on task when conducting business for the district, including while at board meetings, to never surprise the superintendent or each other when conducting official business of the district, to read these norms at the beginning of each board meeting and at board workshops as a reminder of how to conduct our meetings, and to continually self-check to determine if we are following our norms when conducting district business. So with that, again, I just want to say welcome, good afternoon. Thank you for joining us, to all of our staff, to our guests, our board members. Glad you all could make some time this Friday afternoon. We've got one agenda item that I'm looking forward to a good discussion. So with that, Ms. Smith, would you do a roll call vote, please, or roll call?
Yolanda Clark. Maxine Drew.
Maxine Drew, present.
Janie Humphries.
Janie Humphries, present.
Randy Lopez.
Randy Lopez, present.
Wanda Brownlee Page.
Wanda Brownlee Page, present.
Dr. Nguyen.
Dr. Nguyen here.
Dr. Yeager. Thank you.
Thank you. We do have quorum. Unfortunately, for a couple of unforeseen circumstances, a couple board members could not join us this afternoon, but we do have quorum, so we can continue on with the meeting. I would ask for approval of today's special agenda.
So move.
I second it.
Moved and seconded. Roll call vote, please.
Hold on just a second. Maxine Drew.
Maxine Drew, yes.
Janie Humphries.
Janie Humphries, yes.
Randy Lopez.
Randy Lopez, yes.
Wanda Brownlee Page.
Wanda Brownlee Page, yes.
And Dr. Nguyen.
Dr. Nguyen, yes.
Thank you, everybody. All right, so again, today's agenda really is a conversation with the health department around COVID. I want to welcome our guests. We have with us Dr. Erin Corvo, who's the Deputy Medical Officer for the health department, and then Elizabeth, and I'm going to butcher your last name, I'm so sorry, Grenwich? Grunway, thank you, who is with us, joining us as well. Dr. Alan Greiner, who is the Chief Medical Officer, may join us a little later this afternoon. So I want to just say thank you for joining us, and we're looking forward to a good discussion. So Dr. Corvo.
Thank you, Randy, and thank you all for gathering for this meeting today. We really do appreciate it. We wanted to take an opportunity to update you all on the COVID situation and talk to you about the KCK Public Schools, and also to give you all an opportunity to just ask us a lot of questions if you have them. As you think about going forward, potentially reopening schools, and so we just wanted to make ourselves available for you all to ask the questions that you may have. I have a presentation that we've created, and I'm going to try and share my screen. Are you all able to see this?
Yes.
Thank you. All right, I'm going to turn it over now to Elizabeth Gronway. She is our Chief Epidemiologist at the Health Department, and she'll start us off. Go ahead, Elizabeth.
Hello. So I'm just going to start with giving you all kind of an update on how COVID is going in Wyandotte County and the latest data and numbers that we're seeing. Dr. Corvo, are you able to advance the slides for me?
Yeah, there we go. Sorry.
Yeah, go ahead and go to the next one. All right, so basic situational update. We look at 7-day rolling averages when we look at data. That tells us kind of what the situation is just the last 7 days on average. And so we're averaging 91 new cases per day in Wyandotte County. And so those are just Wyandotte County residents, people that live in Wyandotte County. On average in the last week, about 91 people each day were getting reported to us as positive with COVID. And then our rolling average for deaths is 0.14. So that really, what that really means is that on average, we're not having too many deaths, not the numbers below 1, so less than 1 death per day. However, deaths are still an important metric that we're keeping an eye on. Right now, Wyandotte County's had a total of 202 deaths since the beginning of this pandemic, unfortunately. And one thing to keep in mind with that death data as well is that there is a bit of a delay in when we have deaths reported to us, just because of the process. It takes a while to get the death certificates and verify that COVID was the cause of death. So that's something to keep in mind. And then the third metric that we look at is the percent positivity. So for the entire county, anyone that's tested, 38.6% of those people are going to be positive in the last week. And that's an important metric because it tells us 2 things. One, how prevalent is COVID in Wyandotte County? If we're testing 100 people, how many of those 100 people are going to be positive? Right now, about 38% of those people are going to be positive. And 2, it tells us if we're testing enough. And unfortunately, in the last month or so, we've really seen the number of people in Wyandotte County that are getting tested go down. So we are worried that we're not testing as much as we should be in the county. Next slide. This is a graph, just the number of cases per day by date since the beginning of the pandemic. And this really shows you that first wave that we saw in the beginning of the spring in April. Then we had a second wave in July. And then it was okay for a while. And then come late October, we hit that third wave. And we've really seen continued sustained activity with COVID since October. We really didn't see a dip like we did in the past. We'd really like to see a dip. Next slide. So this update compares our numbers to Kansas City, Missouri, and Johnson County and the state of Kansas overall. The most important things on this table here is the case rate per 100,000 and the death rate per 100,000. Obviously, you can't compare a smaller county like Wyandotte County that's got 165,000 people with a very large county like Johnson County that's got 600,000 people. So that's why we look at case rates per 100,000. And you can see, unfortunately, when comparing these different locations, Wyandotte County has the highest case rate per 100,000. And also the highest death rate per 100,000. So that means that when you compare apples to apples across these different populations, Wyandotte County has been hit harder by COVID than some of these other places like KC, Mo, Johnson County, and the state of Kansas. Right now,
Ma'am, can you go back? Because the pictures are covering the data for Wyandotte County. So can you read it to us, please? I didn't mean to interrupt you.
Oh, yeah, no problem. Dr. Corbo, can you go back 1 slide, please?
Sorry.
So Wyandotte County, we are at 15,288 COVID cases, which puts us at a rate of 9,302 per 100,000. So you can compare that to some of those other numbers with Johnson County and KCMO and see that our rate is much higher than those other locations. And then Wyandotte County has had 201, well, now it's 202 as of today, 202 deaths, which puts us at a rate of 122 per 100,000, which is significantly higher than Johnson County and Kansas City, Missouri.
Okay, thank you.
You're welcome. This is another kind of a picture format of the same information I just gave you. So you can see that our case rate per 100,000 and our death rate per 100,000 is higher than any of the other parts of the KC metro region, unfortunately. This is a graph that shows you the distribution of COVID cases by age group. I think it's pretty clear that you can see which age group is leading the pack here. So the 20 to 29-year-old age group followed pretty closely by the 30 to 39-year-old age group, and the 40 to 49-year-old age group, really those kind of young adults and middle-aged adults, are the age group that's been hardest hit by COVID. And we also believe that these are the age groups that are really driving transmission and spread of the virus in our community. So you hear a lot about how COVID really impacts the elderly, and a lot of the people that are dying of COVID are 65 and older, and that is true. But the virus is not nearly as common in those age groups as it is with these middle-aged and young adults. So that's why some of the actions that we've taken in Wyandotte County are really targeting those age groups in particular, because we think that that's why COVID's spreading so much in Wyandotte County. In addition, I wanted to quickly draw your attention to the school age groups, 0 to 9 and 10 to 19. Their numbers are half or even less of that 20 to 29-year-old age group, which is good. There was a lot of concern initially that school age groups, we'd see a lot of cases and it'd really be out of control, but really it's the middle-aged and young adults that we're seeing the most cases within, which is really good news. I'm now going to turn it over to Dr. Corvo, and she's going to give an update on the hospital situation.
Thank you, Elizabeth. I just wanted to present some data. These data are coming from KU Hospital. I wanted to make the point, as Elizabeth said, that, we're having a lot of cases. Unfortunately, we're still seeing an increase in deaths. And so I wanted to present some data around that. With this holiday season, every time that we have a holiday where we come together to meet as families and groups, we kind of have to hold our breath in the health department because we're worried that there may be some more cases popping up. And then, as you may have seen in the news, cases are unfortunately up overall in the state of Kansas. This is from KU Hospital. And so the reason I'm telling you that is that these numbers are comprised not only of Wyandotte County residents, because KU Hospital serves a very diverse crowd from rural, urban areas and whatnot, mostly though people around the metro area. But it just gives you a sense of what our hospitals are dealing with and what they're seeing. I just want to call your attention here to that mortality rate. They're at 9.6%. What that means is that for the people who enter the hospital with COVID-19, unfortunately, almost 10% of those people are dying of COVID. The average age of people who go into the hospital with COVID-19 is 57, and then the average age of death is 66. As Elizabeth alluded to, a bit of the older population, of course, is dying, but we do think that those younger and middle-aged people are probably spreading the virus more. As far as hospitalizations at KU, just over the course of the pandemic, you can see here that in November and December, the hospitals have been hit really hard, or at least our hospital at KU has been hit really hard. But we think that's a good representation of area hospitals in Wyandotte and the metro region, so that in November and December, we had a lot of people in the hospital with COVID-19, and it looks like it's continuing to stay that way. Our deaths have kind of been up and down through the pandemic, but you can see there the blue bars for November and December, a lot of admissions to the hospital. The red bars have continued to kind of be a bit higher than they were earlier in the pandemic, and the mortality rate has grown. I want to switch now and talk to you all a bit about some health order changes that were made. And specifically, we have a new school order that was released just this week. You may say, why are you relaxing some of your school orders with the data that you just presented? And I want to emphasize that we have a strategy in the health department right now that we've decided upon, and that is that we really want to prioritize our kids and prioritize our teachers, prioritize that process of education, because we're becoming very worried about them. We've heard from you all. We've had conversations with all of our superintendents, including Dr. Miguel, and we're worried about that scholastic achievement. And then knowing that the numbers of cases are pretty low in our school-age children, what we're trying to do is prioritize education and keep the rest of our community health orders to be pretty stringent. Again, have gathering orders, that mask order that's in place, keep the bars and restaurants at 50% capacity, but then try and open up our schools a little bit here and make some changes so that our kids can get back to a little bit more normal education processes. So a couple changes that have been made recently. Number one, we've decided to think about the way we're quarantining kids. So in the other districts that have gone back, when we would find a positive case within the classroom, we would quarantine all of those kids and take them out of school for 2 weeks. That was a lot of kids, actually. So now what we're doing is we're quarantining those children who are, sitting to the right and left and to the forward and back of that child. So just the kids who are around that positive case. We are offering more specific mask guidance to teachers and students. For teachers, we're going to be supplying them with KN95 masks, and we're asking if they have N95s that they wear those. And for students, we're requiring 2-ply masks made of cloth or the paper surgical masks. We are continuing to offer guidance on spacing. We're wanting our middle and high school students to remain 6 feet apart at all times. We think that's a really important mitigation strategy. And we're also, though, allowing, because we're cohorting our kids so tightly in elementary schools, for 4 to 5 kids actually to sit together at the same table to learn, but those specific tables then should be far spaced from the other tables. So again, just trying to keep children spaced appropriately. And then we were not allowing any of our middle and high schoolers to make changes in their classes during the day. They were sitting in the same classroom and they were cohorted extremely tightly. And we were doing that to make sure that we could then quarantine kids if there was a positive case or if they got sick. And at this point in time, our schools have done an exceptional job of this, and we haven't had many cases. So what we're going to do is actually say, all right, we're going to let you change classes now up to 4 changes a day. Some schools will be adopting this. Some have said they want to wait on it, but that's an option. I just wanted to update you on the numbers. Elizabeth, I might, if it's all right with you, turn this back to you. These are the numbers that you have gathered, if you want to talk through these.
Sure. So throughout the fall semester, last semester, we worked closely with the school nurses to track the number of COVID cases that they identified in their school districts. And we kind of tracked that data at the health department. Not all of these cases acquired COVID from the school. In fact, most of them acquired COVID outside of class. They were exposed maybe at family functions or at friends or other outside of school activities. But we counted any case where it was a student or a staff, we counted in this data. And this was from the beginning of the fall semester to the end. Turner School District identified 126 student cases and 27 staff cases. Piper identified 58 student cases and 9 staff cases. And Bonner Springs Edwardsville identified 54 student cases and 11 staff cases. So this number initially might seem like kind of high numbers, but in reality, we saw very little transmission within the school districts. A lot of these cases really reflect kind of the transmission levels that we were seeing overall in the community. So I think that was kind of reassuring for us to see that there wasn't a lot of big outbreaks or spread within the schools. Throughout the semester, we also tracked any outbreaks. We did identify 3 outbreaks over the fall associated with sports activities. So 2 outbreaks associated with soccer teams and 1 outbreak associated with a softball team. And we do still feel that close contact sports do pose a higher risk of transmission versus students sitting independently and quietly at their desks. So I think it's important to acknowledge that there's kind of a difference in transmission between those two different activities. And we will continue to track the COVID numbers as we move into the spring semester as well. So it's important data that we're going to continue to keep an eye on here.
Thank you, Elizabeth. I appreciate that. Wanted to just also mention vaccines. I'm sure many of you have questions about what's happening at the health department and where we're at. We are offering vaccines at this time for health workers. And we are set up over at our old Kmart site. That's at 78th and State Ave. We are working really hard to set up 2 additional community sites that are going to be in the easternmost and westernmost parts of the county. And so eventually we'll have 3 very large sites for vaccinating folks. We are currently offering the Moderna vaccine. That's what we've gotten from the state, which is awesome. And that vaccine is, you get the first vaccine, and then 28 days later, we give a booster shot. And then 2 weeks past that booster shot, we think that folks have about a 95% immunity to COVID. So we're excited about it. A lot of our healthcare workers are excited about it as well. So here's a couple pictures just to show you all. We would invite you to come over to the Kmart and check it out as well. You'd be welcome. But here is our logistics guy, Bob Bennett, who's new to our team, but who has helped us set all of this up. And you can see there that it's a large building with really great opportunity for appropriate spacing and such. There are 10 lanes that folks can go through to get their vaccination. And that's a little vaccine card that he's holding up on the left, which all of you will get once you get your vaccine. This is just a picture of our freezers and our refrigerators where we keep our vaccines. Here's the lanes again. As folks will wait, you can see that on the floor there's marked areas where they wait to continue our spacing, make sure that we're doing everything appropriately that way. And then after we receive vaccine, we're asked to keep people to watch them for 15 minutes just to make sure that they're feeling good and that they haven't had any reaction. Should they have an allergic reaction or need to lay down or something like that, we have that space for them to do that as well, and appropriate medical care there that can be offered, although we haven't had any issues to date, and that's very rare with the vaccine. A couple more pictures here. Just again on the numbers, even though we at the health department have only received 800 vaccine, we have received some gifts of vaccines from Vibrant Healthcare, Southwest Boulevard Clinic, and also SWOPE. So it's been really great. I think Wyandotte County always works together, and this is evidence of that. And so we've been able to receive just this week, then our numbers went really pretty high. We've got 2,900 vaccines, which is great. So we're working on our emergency medical services, our forward-facing healthcare workers who are dealing with COVID patients, and our health department staff who are out doing the vaccines and the tests and such. And so we are hard at work on all of this. You guys are probably wondering, when are the teachers going to get vaccinated? And that's really the information that's important here. So we expect this Kansas vaccinations phases information was offered to us just last evening. So this is hot off the press. But just to let you know that currently we're in that phase 1 there that you can see toward the left. And you can see that we're doing our long-term care facility workers and folks who are living in those facilities, our healthcare workers, and then workers who are critical to the pandemic responses we've talked about. Phase 2 here, we're going to be offering the vaccine to folks over age 65, and then people who live together in congregate settings, and high contact critical workers. Teachers fall into this category. They are high contact critical workers. And so we just wanted to let you all know that this phase 2 is going to be coming pretty quickly. We expect to be able to get into phase 2 probably by the end of the month. if not end of January, beginning of February, but we are getting close. And then on from there, we'll go through phase 3, 4, and 5. Also, I wanted to offer some information about how to sign up for the vaccine. I would encourage all of you to fill out this survey. If you go to our website, you can see there on the left-hand side in blue, the wicokck.org /COVID-19 website. There is a button there. You can see the black arrow here pointing to it that's called the WICO Vaccine Interest Form. And so we're encouraging everyone to fill that out. And we have also at the health department been in touch with all of the superintendents and have asked for numbers on teachers and staff who would like to receive the vaccine. And so I know Dr. Miguel and her staff are trying to get information as to who within the school would like that. But just so you all know, this button here, once you click on that, it leads to a survey, and anyone in the county is encouraged to fill that out. Tell us who you are, how old you are, what conditions you have. And when the vaccine is available for you, we will get in touch with you and encourage you to come in to get that vaccine. So that's the end of the comments and presentation that we've prepared for you today. I just want to offer myself and Elizabeth to answer questions and see if you all have anything that you want to discuss. We're here for in-depth conversation as well as you see fit. Thank you.
Thank you, Dr. Corvo and Elizabeth. I know it looks like Dr. Greiner has joined as well, so I just want to welcome Dr. Greiner, who's with us today. I know you and your teams have been hard at work, and so I just want to say on behalf of our community, our district, our board, thank you for all the work and hours that you and your staff are putting in to try to keep us all safe. So just wanted to start with that, and I'll open up for any questions from board members.
This is Wanda Brownlee Page. I'll start with the mask. I didn't hear you say it was mandatory. So is it mandatory?
Yes, it is. And I apologize if I left that out. The mask mandate is still in place. That has never changed, both for the county wide mandate, but also within the new school order that is mentioned. So we're going to have a mask mandate both for kids and teachers and staff at all times.
And it's up to the district to provide the mask, because you said for the elementary kids, if I heard you correctly, that they should have a 2-ply mask. And I know some of the masks we were given at the beginning with the district, that it didn't seem 2-ply. So is that something you guys are going to provide, or we need to provide for the kids?
That is something that we are not able to provide for the kids, unfortunately. We recommend either a surgical mask like this. We can probably get you all some surgical masks. I don't know if we can provide enough for every kid, but Dr. Miguel, let's be in communication about that. We'll do what we can. The 2-ply comment, it was with, what am I trying to say? Sorry. Fabric masks, that's the word I'm looking for. With fabric, the fabric should be 2 layers at least, instead of the 1. We've become worried about those, have you seen the neck gaiters where the kids pull them up and down? And we don't think that those are effective. And so the reason we're offering more guidance on this is really just to make sure that those kids are safe.
So Dr. Corvo, this is Randy. So question around the vaccines. I know that there have been some national stories about Kansas being slow in getting the vaccines out, and the numbers here in Wyandotte County. Do you expect to get higher volume of vaccines and then being able to speed up how the number of folks that are getting vaccinated? And could you talk a little bit about that, please?
Sure. Thanks, Randy. We expect this to start to speed up. Unfortunately, we don't get a lot of information, so to speak, on when and how many vaccines we're going to get. It's really very interesting. So we're expecting another shipment to come in, I believe, on Monday morning, but we do not know how many vaccines we will be receiving. We're hoping that as the vaccine rollout continues, that the information will, be coming to us beforehand a bit more. There was a large shipment of vaccine, I believe, that KU received this week, and that was just specifically for, the healthcare workers there. And so we expect to get another shipment this Monday. As far as the slow rollout, yeah, unfortunately, Kansas has been in the news for that. We think that it's probably because our WebIZ system, and that's the system, the database for the state where we input vaccines once we've given them. I'm sure your school nurses are familiar with it, and we certainly are at the health department, but it's kind of a clunky system. And so we wonder if that's a reporting issue. As soon as we get those vaccines, we're getting them in people's arms. I think at least in Wyandotte County, we're ready to go.
This is Janie Humphreys. I have a question. We're Wyandotte County based, but some of our staff are from other counties. Can they get the vaccine, or do they need to get it in the county of where they live?
That's an excellent question. We are going to give vaccines to people who either live or work in Wyandotte. So that would be just fine. We'd be happy to offer them a vaccine as well.
Okay, thank you.
Sure.
And Dr.
Would you provide
a quick follow-up on the survey that you showed? If the district employees filled out the survey we sent, do they still have to do the one that you showed on the screen?
No, that's a great question too, Dr. Miguel. We, for the schools, for teachers, essential workers, if you are going to give us that information of the numbers of folks who you have who want to get the vaccine, we'll accept that. I just wanted to make sure that was out there, because a lot of our teachers, they have families too, and a lot of people are interested in in signing up. So we want to get the word out as widely as possible. Thank you for that.
This is Wanda Brownlee Page again. You said that in Wyandotte County is 38.6%. Now that means we're 11.4% from being at 50%. And that doesn't bother you guys?
Sure does bother us. Sure does bother us big time. I might turn it over to Elizabeth, and she can talk about sort of the numbers of people coming for testing and what that really means there. Yeah, it's very concerning. I agree with you.
Yeah. So it is concerning. And when I mentioned earlier that that percent positivity number, it really tells us two things. It tells us how many people in the county are testing positive, and thus how prevalent COVID is, but it also tells us whether we're doing enough testing or not. So let's say you have 100 people that go to get tested, and all 100 of those people are feeling sick and have COVID symptoms, then your percent positivity is probably going to be very high. But if you test 100 people and maybe only 50 of them feel sick, and then 50 of them are what we call asymptomatic, they feel fine, then your percent positivity is going to be a lot lower, because it's less likely that those asymptomatic people have COVID. And so I think that what's happening right now is we are not testing enough people in Wyandotte County. We have the capacity to test way more people than we're testing right now. And so what's happening is the only people that are coming in for testing are the people that are maybe feeling kind of bad and sick, or maybe they know they've been exposed to COVID. And so that percent positivity number is a lot higher than if we were testing more people and getting a better picture of what's going on in Wyandotte County. So if I tested 100 people at random, just 100 people off the street, and I tested them, that percent positivity number would probably be a lot lower than 38%. So I agree with you that yes, it's concerning, but we have to look at the whole picture of what percent positivity actually means.
Okay, I have another question. Okay, let's say we let the kids go back to school. Now, I was in a meeting the other day with a group of other districts. The lady in Piper said that you guys help them and that you provide them kits that they can test on the spot. They have a courier that comes and picks up. I mean, would that be offered to us so that we can make sure that we're testing on the spot and can do it and get the results back?
Yeah, so that's something that we probably should have talked about in our presentation. We've used a lot of really good testing strategies in some of the other school districts. So we partner with a lab called CRL, which is just down in Lenexa, and we're all able to offer them as much free testing as they want. And it's saliva testing, so it's not even the uncomfortable kind of testing where they put the Q-tip up your nose. It's just spitting into a tube, which is really fun for kids. They think that it's great. And so anytime a student or a staff in those other school districts has any symptoms of COVID at all, they're sent to the school nurse. The school nurse has the kids spit in the tube and then they send them home. And within 24 hours, usually it's about 12 hours, that student's test result is back. And we know right away, did that kid have COVID when they were feeling sick or not? In addition to that, our school districts, Turner, Piper, and Bonner, are also doing randomized mass testing, where they send those spit test kits home with a bunch of students and staff. Anyone that's willing to do one, we send it home and they do it. And before winter break, actually, USD 500 tested a bunch of their staff as well. And so we plan to offer that again. And also for the USD 500 staff, I'm working with Elizabeth Morris, and we'll be able to do more mass testing. And so if USD 500 decided to go back to school in person, those are a couple tools that we could use to make sure that we don't have uncontrolled COVID in the schools.
Okay.
This is oh, go ahead, Ms. Page.
No, go ahead, because I've asked a couple. You go ahead.
Sure. So this is Randy. Thank you for the information. So I just want to say, our board and staff have been very consistent since the start of COVID, and we continue to be virtual with our schooling, and in order to try to keep as many folks safe, our kids safe, our staff safe. But we also recognize, like Dr. Corvo, you talked about at the beginning, the how this is hitting our students, and especially those younger students being out of the classroom, and how that's impacting their education. So are you seeing that as we gain more information, that sending groups of students back is a little more safer now that we know more about the virus and how to keep each other safe than it was back in March? Because if you look at the charts, right, the virus seems to be a little bit harder and harsher now than it was back in March, but there are things that we know now to keep each other safe.
I think that is true. We've been following the data really carefully, but also reading as much of the medical literature as we can. And it's really tough because it's being produced, day in and day out as we go through this pandemic. Everything seems so new. One thing, though, that we've learned is that fewer kids are positive than we thought. This virus doesn't spread the way that we thought it would within schools. And one of the reasons why we think that is that some of our children, especially those little kids, actually have some immunity to COVID because they've gotten other coronaviruses. It's very interesting. And that's less the case for older people. And so we think that there's probably some protective effect with the kids. We do worry about the teachers, and we do worry about their parents and such. It's not like it's just A-okay to go, without any mask and have regular classes as usual. No way. I mean, we really want to make sure that we're putting together, a good plan to keep everybody safe if we do bring kids back. But yes, Randy, that's true. I think the research and our thinking on this has really evolved over the course of the pandemic to where we feel more confident about kids getting back to the classroom.
This is Wanda Brownlee Page again. Have you guys done any research? We're saying the kids aren't positive, but what about their families to follow up to see? Because I could be asymptomatic, but then maybe I bring something to my parents. So what's the data on that? Have they done any research to show these kids went to school, and as anybody said, well, we're going to test their family members to see if they are infected in any way. It may not have affected the kids, but it could affect the other adults in the house. So what's the data on that? Do we have any research?
I don't think that we have a specific research study that we've done locally. However, I do think that your concern is absolutely valid. And I think that's why we've said we've got to maintain that mask wearing. Again, one thing that we have learned through what we've observed in Wyandotte County is the kids who get COVID are not getting COVID in the school. They're getting COVID outside from the school. It's not spreading. It is not commonly spreading within our classrooms from kid to kid or from within, our school activities. That is very rare. The thing we're seeing is that kids are getting it out in the community, doing whatever they're doing, with their families and whatnot, and then actually bringing it to the school. And then of course they go to school and then it puts other kids at risk potentially. But that's kind of what we're seeing most prominently in our data. Elizabeth, do you have anything to add to that?
No, I don't think so. It's hard. The thing about COVID data, sometimes it's very hard to track. We try our best, but it is hard to track and we don't have all the data that we'd like to have. So we don't necessarily know if children are bringing it home and infecting their family members or not, because we just don't have the ability to track that kind of data. But from the contact tracing that we do on children who have become infected, the vast majority, like I mentioned previously, acquired COVID out in the community and not out in school.
And I have another question, and we hear so much, and again, you're trying to establish in our society today what's fact and what's opinion, and we want to make sure that we use proper data with the mutations. Yeah, I haven't heard them say anything was here in Kansas, but we heard about California, and I can't remember the other two states that it was in, and they focused on the case in the United Kingdom. I don't know if you have read anything or seen anything with the situation in Denmark with dealing with the mink animals and the mutation and all that stuff. So what do you guys have anything on that or know anything about that?
Right now, we are not aware of any of these new strains or mutations of the virus that are in Kansas City or Kansas. The state health department does test about 200 or 300 samples each week to look for mutations and genetic sequencing like that. So they are working to identify it, but at this point in time, we are not aware of those. And there's still a lot of unknowns with that. We don't know how it's going to spread if it does come here to our area. We don't really know, how it would respond to the vaccine. We think it would, the vaccine would still be effective with these other strains, but there's just a lot of unknowns. COVID, just like any other virus, can rapidly change.
And if we take a shot, say we take the shot, would we need to do it like our flu shots every year?
We are hoping not. We're thinking that at this point in time, it's a two-shot series, but I think that remains to be seen. But at this point in time, we think that those different strains that Elizabeth was talking about will respond to the vaccine. And so we're very hopeful that it'll be a two-shot kind of deal, and that's it.
Okay. And then you mentioned that, and the young lady talked about having the mass testing, the testing with CRL, and then what about tracking? You guys do the tracking, or who would do the tracking?
So the way it works is anytime a school nurse identifies a case within her building, whether that be a student or a staff, she fills out a reporting form that has basic, information about the student or staff who tested positive, their name and when they tested positive and where, and if they were in class while infectious at all. what days they were in class, who their teacher is. So the school nurse collects all that information and then she emails it to the health department. And then I keep track of all of those various cases on a spreadsheet to track how many cases we have in each school building. And one thing that Dr. Corbeau mentioned with these new school health orders is that we're only quarantining the students seated directly around a positive. But if we identify more than one case within a classroom, that means we could have a problem and there could be spread within that classroom. And then that's when we would quarantine and shut down that whole classroom for 2 weeks. And so it's the school nurses that are actually doing a lot of the legwork of identifying who the contacts are, calling the parents, telling them that they need to quarantine, for how long, all that stuff.
Okay, thank you.
Randy, I have a couple questions, please.
Yeah, please. Dr.
Good afternoon, and apologize for the switch from the phone to the computer, from the car to the home. I have 3 questions, please. Let's start with the quarantine. I was able to see the numbers that you provided for cases, and I think I know what Ms. Page was talking about when we heard the legislators met with the districts. Turner superintendent said that they quarantined a couple of schools this past semester. And while Piper didn't mention quarantine, Piper parents have told us that they have quarantined a lot. Do you have numbers on quarantine? I mean, it doesn't seem like what we're being told about students being quarantined fit the numbers you provided us.
So a couple things to address that question. Dr. Corvo mentioned we changed the orders and how we quarantine. So before, if one student tested positive, we would quarantine the entire classroom. So that means potentially for every positive student that you identify, you'd have 25 students out on quarantine, plus the teacher, plus maybe the TA or the para. So we were quarantining a lot of people for every single positive case. And we at the health department did not track the number of students out on quarantine. That was the school nurses that were tracking the numbers that be out on quarantine. In addition, you referenced that Turner School District had to quarantine a couple whole schools. And there were a couple schools in Turner that you might have seen on the news during the fall semester where we had so many cases that we were concerned that there could have been spread within the school. And so we made the decision to switch that school to remote learning to give time for anyone that would have been exposed to the virus to quarantine before coming back. And that's one way that we break the chain of transmission to prevent COVID from continuing to spread. So when KCK Public Schools decides to go back to school in person, that is always a decision that we could make at the health department level, along with the superintendent, is if we feel that there is transmission going on within a school where kids are passing it to other kids, then that would be when we would make the decision to ask a school to go back to remote.
Okay, but thank you for that, but that wasn't the answer to the question. The question was the data that you just provided us, do those numbers reflect those, for example, those 2 schools quarantine, are those new data? Is that data based on your new guidelines?
No, the semester just started, so we don't have the new data. The numbers that we presented was the number of cases of COVID.
Okay.
The number of children and staff diagnosed with COVID during the fall semester.
Okay, so
Yeah.
Do you have numbers of quarantined students? The numbers, total numbers of students quarantined?
No,
We don't have them right this second, but I'm sure we could figure that out. Yeah.
Oh, okay, and then so are your guidelines different than CDC's? So the quarantine is still 10 days or 14 or what?
14.
14.
Yeah, 14 days. Yeah. So quarantine is for those people who have been exposed or potentially exposed to a positive case. Quarantine does not refer to the case itself.
I understand that.
Okay, yeah. Just
Your second question, please. The lady from Piper suggested that they do daily screening, and your answer to another question reflected the responsibilities of the nurse. My ongoing dialogue with some of our USD 500 staff is concerning taking one's temperature. What is your best suggestion, ruling, opinion on taking temperature, the value of taking temperature, the role it plays in a diagnosis?
I think that that we've seen a lot of COVID cases in people who do not have fevers. So I'll say that my recommendation would be to take a temperature at home before coming to school if possible, and do not come to school if you have a fever. One concern that we've had, we used to take everybody's temperature before they'd walk into any building, and we were finding that a lot of people were clumping together when that was happening. We didn't think that was weeding out any more than, putting forth those other saying, look, if you have these symptoms, don't come. So unfortunately, it's not that everybody, has fever for sure if they get COVID.
So why, when you go to the hospital, the first thing they do is take your temperature, or you're not allowed to enter a hospital? And I'm speaking KU Med.
Right. Yeah, I agree. I work there. I mean, we got to put your wrist up to the sensor and stuff. So I think it's one way of saying, if you do have a fever, you catch those people. But I do think that there are probably a lot of people walking around who have other symptoms who also have COVID. So
if you don't take the temperature, what would be then a reliable screening protocol for children?
We have a good list of symptoms that we think are often there, at least one or two of those symptoms, when somebody gets COVID. Unfortunately, it's kind of a long list, but we're encouraging, and Elizabeth has been in touch with all of the school nurses and superintendents, we're encouraging all of our families then to ensure that their kids do not come to school if they have that list of symptoms.
But let's be realistic. With 22,000 kids, and we'll just say working class, which is code for, they're receiving at-risk, low income. They're not going to take it. Perhaps they won't take it at home. So what is the proper protocol for then a school district trying to keep?
That's a good question. I think that we have had a lot. I mean, the reality is a lot of the parents, most of the parents are going to work, and they need help for their kids, and they have their kids in school sometimes even when they're having these symptoms and such. And so our school nurses and teachers have all been kind of working together to identify those kids. And as Elizabeth mentioned, as soon as we do identify that, because we have testing within the school, we test them right then and there on the spot, call their folks, and have to get them home. But again, it's, I hear you. We're trying to overlay sort of different layers of sort of mitigation strategies here. I know it's not perfect, but we are asking families to keep their kids home if they have, again, that list of symptoms.
Well, as a physician, you have certain protocol, no matter what you are patient you're seeing. And so this is what is not, and I apologize, I'm not hearing a clear answer, and maybe I'm not asking the question specifically, but if temperature taking is not then a reliable strategy, and you say there's a whole list, okay, so I guess I will have to look at that list again.
Yeah.
How do you keep the virus from breaking out once we have now resumed in-person classes?
Yeah, if I could add one other thing to keep in mind as well. So COVID is a virus, flu is a virus, there's a lot of viruses, and so there's not a best screening practice to keep flu out of a school building, or to keep measles out of a school building, or pertussis, or any kind of infectious illness. We have a lot of best practices that we think work really well for keeping COVID from spreading in the building. Things like wearing a mask, keeping kids home if they're sick, testing sick kids, social distancing, all these things we think work really well to help prevent the spread of the virus, as we've seen with our other school districts. But I think that what you're trying to ask for is a foolproof way to make sure that COVID's not coming into buildings. And just like any other infectious disease, there's not, that doesn't exist.
Well, thank you, but no one is asking for a foolproof system, because otherwise you wouldn't have 400,000 deaths. So sorry that you had that impression, but that is not what I'm asking for. I'm asking for some clarification, because we have the discussion, and we will take this discussion back to our board. And that's the understanding. And so as we have these discussions, when I enter the State House, I must have a mask and I must have my temperature taken. When I go into KU Hospital or North Kansas City Hospital, I must have a mask. I must have my temperature taken. You all know this. That's all I was asking for, was some type of statement to say that those were protocols that many doctors recommend. No one's going to have a foolproof. So that is not what you're asking. But let me ask one more question. Thank you. The positivity rate. If it's 38%, and we know how you compute positivity rate, according to the gating, I guess, criteria, there will be no sports. And I think 15% is like the red zone. How are you gauging your, I guess, with 38%, how are you basing, I guess, your comments? What are you basing your comments on? Just that we got to get the kids back in school?
I think, again, we don't think that we're able to do enough tests. I think if we had tests for everybody in the county, that number would go down quite a bit. Of the people who are coming to get tested, we think that they're not feeling well. So we think that we're just getting some small portion, although we are open to test everybody. We think if we tested everybody, that number would be driven down quite a bit. I know that, you're speaking about, I believe, the state recommendation that was released regarding when to play sports, that sort of thing. There was like a gating criteria that was released. And in Wyandotte County, we have never one time during this pandemic been low enough at all to get back to any school whatsoever, nor have we been low enough to even, practically have anybody in our buildings. And we think that that's because we haven't been able to test enough. Although we understand that the virus has hit our community hard. Again, we do think, though, that with the research that has come out, that our kids, it's this balance of sort of their emotional, physical health, the health of their families, the economic piece of it, the mental health piece of it, and such. And so we have a really hard time weighing these things. We think that our other districts have done a pretty good job of opening or doing some in-person schooling. And so we just wanted to have the conversation with you all. We're not trying to convince you either way. Just want to give you an update of where we're at and let you all make that decision.
Thank you.
And I just had a comment, because what's so confusing is when we look at the news and they're showing, world news shows Kansas and Missouri, our numbers are extremely high. And then the hospitalization rate is high. Then local news, because Kansas doesn't do it every day, Missouri does to a point. You're trying to keep the data straight and make sure you're understanding, because our goal is we want what's best for the kids as well as the teachers. And we got to keep the teachers safe, because you got to have somebody here to teach the kids. And a lot of the teachers are worried because we got our older, to a certain degree, we have an older staff, and we're trying to make sure everyone is safe. And that's the catch-22. Because it is crazy that we go to the doctor, we go to the hospital, or we go wherever we can get in, and every funeral, whatever, they got a thermometer and they're checking your temperature. And then to hear you say, well, if they just say parents check them, and I get what's going on, but we're in a catch-22. We're trying to figure it out. We all are. You're trying to figure it out. We're trying to figure it out. But that's a problem. And there's no, at times it doesn't seem any consistency. And you're just trying to work it out. What is it? Is it this or is it not that? So that was just my comment. I'm not a doctor, but just trying to understand.
Miss Drew, it looked like you had a question. I know you
Yes,
have
I do.
a
Thank
chance.
you. I would like to, I'm Maxine Drew, and would like to know, you showed us a slide whereas after they take the vaccine that they will be there for about 15 minutes. And so have you all found any data that shows that the effect of the vaccine that is given will affect some people with different types of medical problems within their system?
Ms. Drew, are you referring to like any reaction that would happen if you have a certain health issue?
That's correct.
No, not necessarily. You know, there is that concern with people who have severe allergies, like to where they need like an EpiPen if they have like a severe food allergy and stuff. You've probably heard there have been just a couple cases, you know, all over the course of the vaccine rollout, you know, all over the world. But we haven't seen any of that, and we can't say that, oh, you know, because you have, say, diabetes, you're gonna for sure get a rash or something. We don't have any information like that. We are especially concerned if people have had a severe reaction to an actual vaccine in the past. You know, that would be another conversation. But otherwise, no, we don't have anything. And again, the allergy thing, that shouldn't keep anybody from getting the vaccine. That is so exceptionally rare. And again, we have what we need to respond to it if that happens.
Okay, thank you.
Sure.
Randy, I have a couple of questions.
Sure, go ahead, Janie.
When we had the legislative forum the other day, and the other school districts were reporting, there was a couple of things I noticed. The other school districts in Wyandotte County are very small school districts, student population-wise, compared to ours. And two of them are very different demographically than ours. And does the health department have any information on similar districts to ours in size and demographics, how they've approached bringing their children back to school? You know, a 4,000 or 5,000 student district with buildings with smaller populations, whereas we have buildings that have 600, 700, 800, 1,000 students in a building. And we are high minority populations, which are more susceptible apparently to the virus. Do you have any information about that?
I don't locally per se. We have been reading a lot about other larger cities, you know, specifically like New York City and such, and how they kind of reopened partially their schools. And that's been really helpful for us because I think the density, you know, in the KCK public schools is different than the other districts as you speak of. And like you say, the diversity is really different as well. So it's been helpful to read that they've been able to go back to school for some of the time. And they've kind of opened and closed as we've watched. It's kind of interesting to see. But it's tough. I don't know that we have another district really closely related locally that we've been able to look at in depth, unfortunately.
Because that concerns me for our parents, you know, being on site for a week or two and then closing, going back and forth, I think would be harder as a parent than staying remote. The back and forth part is very hard on parents and children. I want our children back in school, but being here 1 week and there 1 week is very difficult planning for parents.
I think that's right. I think that we've heard that from our other districts to some extent. You know, a lot of the parents are just so excited that they've got kids back in school. But then what do you do when you're working, you know, you've got, each parent is working or whatever, or a single parent who needs to work, and then all of a sudden school's closed, you know. So they've indicated, some people have indicated that they just want to do online school, and the other districts have given them that choice, and some percentage of families have taken it. They've said, yeah, we're going to remain online.
Because one of our districts was saying that they added extra bus routes. They have a separate bus route for their elementary, middle, and high school. But we already do that. We already run our separate routes, so it's not quite as easy as it is for a 3,000 student district. So I was just curious if you had any information for more of a similar sized district as ours. So.
Yeah, but, believe me, I can imagine that the logistics are difficult in a large district. Yep. Yeah.
So Dr. Corvo, I've got a few questions, and I'll just spit them out, and then you can answer in whatever order. And I also want to be respectful of you and Dr. Greiner and Ms. Grenway's time. So if you have to jump off, let us know if you have a hard stop soon. But I do have a few questions I'll throw out there. So in phase 1, healthcare workers are able to get the vaccine. Does that include school nurses and or social workers? Are they a part of that group? And that's probably something already has been discussed with Dr. Miguel. The second question, and I'm just going to shoot them off and then you can answer in whatever order. Could you explain a little bit about the difference between the Moderna vaccine and the Pfizer, and why we're getting the Moderna? And are we going to have an option on either or how does that work? Well, the last one, I'll hold on to the last question after those two, if you don't mind. Thank you.
Elizabeth, do you want to speak to the school nurses question?
Yeah, we've already vaccinated all the USD 500 school nurses that wanted to get vaccine. And actually today I spent my lunch break calling all of the PT, OT, psychologists, and social workers to schedule them for vaccine.
Thank you very much.
Yay. And then the difference between the Pfizer and Moderna vaccines, there isn't much difference actually in the way that they work. So they're both these mRNA vaccines, and it's really interesting. So the mRNA is sort of encased in a little lipid or fatty particle, and it tells the cell to make these little spike proteins, and so that your immune system can recognize them and mount a response if you should get COVID. It's really pretty ingenious, and both of them work the same way. Logistically speaking, they're slightly different. So the Pfizer vaccine has to be kept in 80 below 0 degree storage. So it has to be in a super freezer. And then once you get the Pfizer vaccine, 3 weeks later, you would get the second vaccine. For the Moderna vaccine, it can just be refrigerated. It doesn't need to be in the ultra cold storage. And that's after you get the first Moderna vaccine. 4 weeks later, you would get the second booster Moderna vaccine. You can't cross brands. If you get the Moderna, you got to get the second Moderna. If you get the Pfizer, you got to get the second one Pfizer.
And you all are offering, so right now we're offering the Moderna in Wyandotte County is what the health department has.
That's what the health department has received thus far. I do expect that in the future we'll probably get some Pfizer vaccine in, and we have the capability to have both. We have the ultra cold freezers and such. So whatever they'll give us, we'll take.
Thank you. And then just the last question, and I do just want to, again, say thank you to you and your team, the health department. I know how hard you all are working. I sit on the health equity task force with you and Dr. Greiner, and I do just want to acknowledge the hard work that you and all of the staff do in trying to keep all of our counties safe, and working especially with the schools. I know we're still remote, although we do have pockets of students that are back in the school, like our special education and some of our ELL students. And so I know you all are working with Dr. Miguel and our staff to make sure that whatever plan we put in place, and I think, whether it's taking temperatures or the other. I know when I go to central office, I have to take my temperature and fill out the checklist every single time. So I know you're helping us to develop what those things are. If whatever point we decide to bring students back, I'm wondering, does that require the district to put a plan to the health department that would then have to be approved by the health department to say, yes, this works, you guys can come back under this plan? What, or could you talk a little bit about what your expectations would be?
Yeah, we have asked that our superintendents bring us a plan, and we don't have to be, excruciatingly detailed per se, as long as I see that there's, sort of a skeleton of what you guys are planning to do, and how you plan to follow the sort of mitigation strategies in the order and such. And each of them look a little bit different, and it mostly has to do with how are your kids going to sort of move throughout the day? How are your teachers going to move throughout the day? It's been a real joy to work with Dr. Miguel and you, Randy, and others in your district. And I want to recognize also the hard work that you all have been doing through this pandemic. It has not been easy for any of this, and that's well known to us. So a plan would be really great, and we're happy to go back and forth with you, have phone calls, whatever, to make sure that everything looks good, and that also that you guys feel confident with your decisions. Our goals are the same, in keeping kids and families safe, and so really I think there can be a lot of unity about the decisions made here.
Thank you.
This is Wanda Brownlee. I had one more question. So I don't know if you sent it out or I missed it, but what's your take on sports? How are we to do that?
It's a good question. We're still recommending at the health department that contact sports not be played. So we think that poses a risk. Some of the other districts have not taken our recommendation, but that still I think is wise not to play contact sports. It just doesn't follow those strategies that we know work, that social distancing and such. There are some sports that we think probably can be played, and I think it's good for kids to get physical activity. It helps them out. We need to burn off some energy, right? And so some of those sports would be like, track and field, tennis, where you're across the net from one another, those types of things where you can remain apart. But something like wrestling, I don't know. I don't think that seems like a wise idea. It seems like pretty close contact for too long of a time.
Okay, thank you.
Can I make one clarification just to make sure that we're not confusing anyone? Elizabeth, you said that you called OT, PT, and social workers, but it was actually OT, PT, and speech language pathologists. We don't want confusion out there. And the reason they were called is because they are considered healthcare workers, right?
Right. I think the group that I called today was PT, OT, speech pathologists, and psychologists. And then we're going to move on to the social workers soon as well. I just need to get that list from Elizabeth Morris still.
Right. I just wanted to make sure we were clear and that there was no confusion thinking they were called. So thank you so much.
Oh, okay. I'm sorry. I must have
No, you're fine.
I meant psychologists.
Thank you so much.
Thank you for that clarification. Again, I do want to be mindful of your time, and I really do appreciate Dr. Corvo, Ms. Grenway, Dr. Greiner for joining us today. I do want to allow just really quick before we close in any last minute questions, but I also just want to ask Dr. Corvo if there's anything else that we haven't asked you that you think we should be thinking about or asking, or anything else that you want to make sure you share with us before we close.
Thanks, Randy. I don't know that there's anything else really on my mind, but that, if you decide that you would like to give it a go and open to some degree, we're here for you, and we really do want to work with you. Again, we're being really mindful that we're seeing some achievement gaps that are widening, and we worry about that for the health of our kids and their families as well. And so we're trying our best to keep them safe while also being mindful of that. So please let us know if we can be of service to you in the future. Thanks.
Thank you. Again, just thank you to everybody. And this doesn't have to end, right? Board members, colleagues, Dr. Miguel is in contact with the health department every week. And so if we have additional follow-up questions that didn't get asked today, or we think about it later, please send those along to either myself or Dr. Miguel, to Ms. Page, and we can make sure that we can look into that and get your questions answered. Again, I just want to say thank you to our guests. You all are doing amazing work and really great information shared today. I know we have a lot of folks who were watching today's meeting, so I just want to thank you all for the work that you all are doing. Before we close, just a quick reminder, a couple of orders of business. Don't forget, tomorrow we have a couple of town hall meetings for our superintendent search, one at 11 o'clock for the English-speaking town hall, and one at 1 o'clock for the Spanish-speaking town hall. And then we have our regularly scheduled board meeting on Tuesday, January 12th at 5 p.m. Dr. Miguel, was there anything else that you need to share?
No, I just wanted to, again, thank the health department and share with everyone, in case you don't know, they have worked very closely with the Wyandotte County superintendents. We meet every Friday without failure. They keep us updated. They answer all of our questions. They have been great guidance and support. So I wanted to thank them publicly.
Randy?
Yes.
Can we get a copy of those PowerPoint slides?
Mm-hmm.
I would appreciate that.
Randy, I'd be happy to send that to you, and you can send it out.
Absolutely.
Thank you very much for all the answers that you gave us today. Very helpful.
Thanks for the questions.
Thank you so much. Everyone continue to be safe. Have a great weekend. This meeting is adjourned. Thanks so much.